You wake up in the morning, look into the mirror, and those under-eye bags are there again. This happens even when blood tests, heart evaluation, and kidney checks all show normal results. In many situations, this puffiness is not a sign of organ disease. It is more closely linked to how fluid and lymphatic movement behave in the face and neck area, especially when the neck muscles are tight or restricted. A large portion of lymph nodes in the body are located in the head and neck region. Because of this, even minor drainage disruptions in that area can become visible under the eyes. Not every swollen lower eyelid is related to organ failure. In medical terms, swelling around the eyes is known as periorbital edema, and it can have multiple different origins. That swelling may appear due to allergies, localized irritation, infections, thyroid imbalance, kidney issues, and other medical conditions. Clinical references explain that eyelid swelling can either be a harmless reaction or an early indicator of a more serious systemic condition. For that reason, it should not always be treated as a cosmetic issue alone. At the same time, many cases people call eye bags are actually related to normal aging changes in skin and fat structure around the eyes rather than fluid accumulation. One key distinction is appearance over time. When periorbital edema is present, the eyelids often look more swollen in the morning and gradually improve during the day. The area may feel soft when gently pressed, and it often worsens after high salt intake, poor sleep, or alcohol consumption. In contrast, age-related eye bags are usually formed by permanent fat displacement and skin laxity. These do not change significantly throughout the day. Eye specialists and cosmetic surgeons emphasize that confusing these two conditions can lead to incorrect expectations. Creams or massage techniques cannot dissolve fat deposits, and surgical procedures do not address fluid retention. The kidney connection is often misunderstood. Kidney disease can indeed cause swelling around the eyes, because fluid retention increases when kidney function is impaired. However, in typical kidney-related edema, swelling is not limited to the eyelids. It often appears in multiple areas such as the legs and sometimes the abdominal region. Additional symptoms may include fatigue, foamy urine, or elevated blood pressure. Medical reviews on eyelid swelling indicate that persistent cases should prompt a broader medical evaluation rather than focusing only on kidney imaging. If kidney tests and specialist evaluations are normal, other causes should be considered. Heart-related causes follow a similar pattern. In heart failure, blood circulation becomes backed up in the venous system. Pressure increases inside blood vessels, causing fluid to leak into surrounding tissues. This usually affects the lower extremities first, especially the ankles and lower legs, and becomes more noticeable later in the day, after long periods of standing or sitting. While advanced heart conditions can sometimes involve facial swelling, isolated puffiness under the eyes without breathing difficulty, reduced exercise capacity, or leg swelling does not match the typical pattern of heart failure. When cardiac evaluation is normal, other explanations need to be explored. Medical references list a wide range of additional triggers. These include infections, inflammatory conditions, allergic reactions, trauma, sinus disease, thyroid disorders, liver issues, medication side effects, and autoimmune conditions. Among these, allergies are especially common. Pollen, cosmetic products, eye drops, or even laundry detergents can trigger localized inflammation that leads to fluid buildup around the eyes. Infections, such as conjunctivitis, styes, or cellulitis, may also cause redness, pain, and swelling. These conditions require medical treatment rather than home manipulation. Lifestyle factors also play a significant role. Short sleep duration, irregular sleep patterns, high salt consumption, frequent alcohol intake, and smoking can all contribute to fluid retention and fragile blood vessels. The skin around the eyes is very thin, which makes these changes more visible. Dehydration can also worsen the appearance, since the body compensates by retaining fluid. Chronic nasal congestion and sinus problems may interfere with normal drainage around the eye area, especially in the morning, leading to a persistently puffy appearance. A large proportion, roughly a third, is located in the head and neck region. This concentration is understandable. The head and neck contain the brain, eyes, ears, sinuses, salivary glands, thyroid, and extensive immune tissue, all packed into a small facial area. Lymphatic vessels from the eyelids, nose, and cheeks drain towards several major lymph node groups. These include preauricular and parotid nodes located in front of and around the ear, submandibular nodes beneath the jaw, and submental nodes under the chin. From these areas, Lymph continues downward into deeper cervical nodes that run along the major veins of the neck. Anatomy references describe how the region in front of the ear and the parotid area receive drainage from the outer eyelids and lateral face. The submandibular region collects fluid from much of the midface and upper lip. When these drainage pathways remain open and flexible, fluid exits the facial area efficiently. When they become tight, restricted, or chronically compressed, fluid may accumulate upstream. On the face, this can appear as puffiness under the eyes and sometimes a more pronounced jawline. One structure repeatedly highlighted in neck anatomy is the sternocleidomastoid muscle. This long muscle runs from behind the ear down toward the collarbone and is responsible for head rotation and tilting. Deep cervical lymph nodes are positioned along its pathway, near the jugular vein, both in front of and behind the muscle. Modern posture habits, especially prolonged forward head positioning such as looking at phones or screens, can keep this muscle shortened and tense for long periods. Physical therapy and anatomy references note that ongoing tension in this region may compress surrounding soft tissues, including lymphatic channels and blood vessels. If lymph movement is compared to water flowing through a hose, this tight muscle can act like pressure applied to the hose, restricting flow. Fluid then accumulates above the restriction. In the facial region, the first visible effects may appear around the jawline and under the eyes. Clinical examples illustrate this pattern. Consider a woman in her mid-50s working long hours at a computer and using her phone in the evening. Medical evaluations of heart, kidney, and thyroid function show normal results. Despite this, she experiences morning swelling under the eyes, along with a softer, fuller appearance under the chin. In similar therapy observations, practitioners often report stiffness and tenderness along the sides of the neck and near the ears, along with reduced neck extension due to persistent forward head posture. With gradual improvement in neck mobility, breathing patterns, and gentle lymph-focused techniques over time, facial swelling may decrease. This is not attributed to detoxification, but rather improved fluid movement pathways. Manual lymphatic drainage is sometimes discussed in this context. It is a light rhythmic technique that has been used in clinical settings to reduce swelling after facial and neck procedures and to improve comfort following surgery. Some studies suggest that lymphatic and connective tissue techniques in the neck region may help certain cases involving pain and swelling, although research remains ongoing and is not specifically directed at cosmetic under-eye bags. These approaches rely on very light skin movement, rather than deep pressure. Practitioners emphasize careful screening and proper technique before application. This type of method may be considered in consultation with a physiotherapist or dermatologist, when swelling appears linked to posture or mild fluid retention, rather than infection or systemic disease. Medical guidance consistently begins with warning signs. Ophthalmology references list symptoms that require urgent attention, including severe pain, significant redness, fever, general illness, vision changes, double vision, difficulty moving the eye, or sudden asymmetry where one eyelid becomes much more swollen than the other. These signs may indicate conditions such as orbital cellulitis, severe allergic reactions, or vascular problems that require immediate medical care and imaging. In such cases, home techniques are not appropriate and medical treatment is required. When serious conditions have been ruled out and chronic mild puffiness remains, lifestyle and mechanical influences become more relevant. Medical and internal medicine reviews repeatedly identify poor sleep, high salt intake, alcohol use, and smoking as factors that increase fluid retention and worsen eyelid swelling. Chronic allergies and nasal congestion are also commonly reported contributors, including triggers such as pollen, dust mites, and chronic sinus inflammation. Physicians often recommend reviewing daily habits, medications, and environmental exposures with this specific question in mind. What factors may be contributing to fluid retention around the eyes? On a broader systemic level, thyroid disorders, particularly autoimmune thyroid disease, can affect tissues around the eyes and lead to swelling or protrusion. Chronic kidney disease, nephrotic syndrome, liver disease, and severe heart failure may also produce fluid retention that appears in both the facial region and lower limbs. Autoimmune and rheumatic conditions can involve blood vessels and soft tissues around the eyes as well. Medical guidelines recommend a comprehensive evaluation when swelling persists without a clear cause, rather than attributing it solely to aging or stress. In cases where symptoms are mild, chronic, symmetrical, and not associated with warning signs, Certain anatomical regions are often targeted in lymph-focused approaches. These include the areas around the ears and the sternocleidomastoid muscle along the neck. Lymphatic drainage pathways from the outer eyelids and lateral face pass through nodes near the ear and parotid gland, while lower facial drainage passes through nodes beneath the jaw. Manual lymphatic drainage techniques typically begin by opening the lower neck and collarbone region, followed by the sides of the neck, and then progressing upward toward the face. This sequence is intended to create a pathway for fluid movement. A commonly described gentle technique around the ear involves placing the hands lightly over the ear region and adjacent tissue. Slow, minimal skin stretching motions are used, focusing on moving the skin rather than applying deep pressure. The pressure remains extremely light, comparable to gentle contact similar to petting an animal. Do you like this personality? If pressure is applied too strongly and reaches deep tissue pain, it is no longer lymphatic work. That becomes a different type of intervention entirely. Case reports indicate that after several minutes of this gentle approach, some individuals notice reduced puffiness around the temples and upper cheekbones. This aligns with the known drainage routes of that region. Anyone interested in this approach is typically advised to learn directly from a trained therapist. This ensures the method is performed safely and correctly. Another important area is the sternocleidomastoid muscle. It can be felt when the head is slightly turned and the neck is engaged. It appears as a rope-like structure running from behind the ear down to the collarbone. Deep lymph nodes and major veins are positioned along its course. The intention of gentle work in this area is to relax the muscle and reduce tension in surrounding tissues. Some self-guided techniques describe lightly holding the muscle between two fingers and slowly moving downward while rotating the head, always remaining within a comfortable, pain-free range. Physiotherapy guidance stresses immediate stopping if sharp pain occurs, along with any dizziness or breathing difficulty. Individuals with vascular conditions or neck instability require individualized professional assessment before attempting such methods. For this reason, expert supervision is strongly recommended before incorporating these techniques into routine practice. There is also a structural reason behind starting at the neck rather than directly under the eyes. Lymphatic training explains that if the primary drainage areas near the collarbone and neck are not opened first, fluid may be pushed toward already congested nodes. This can temporarily increase pressure and heaviness. The correct sequence follows natural lymph flow, from the face into the neck, from the neck into larger lymphatic ducts, and then into the bloodstream. This reverses the instinct of focusing only on visible swelling. Breathing patterns and movement also play a significant role. Deep diaphragmatic breathing, where the lower ribs and abdomen expand, supports pressure changes in the thoracic ducts and assists fluid movement. Gentle neck mobility, regular walking, and reducing prolonged forward head posture all contribute to improved lymph circulation. Physiotherapy references note that these practices are not dramatic, but when combined with better sleep, reduced salt intake, limited alcohol consumption, and allergy management, gradual improvements in morning facial puffiness can occur. These factors are often reviewed with healthcare professionals as part of an individualized plan. Age is an important variable. With aging, the skin around the eyes becomes thinner and connective tissue support weakens. Research indicates that regions with delicate skin and reduced structural integrity are more prone to fluid retention, especially in middle age and beyond. The efficiency of the lymphatic system may also decline over time, similar to changes seen in veins and joints. As a result, two individuals of different ages may respond differently to the same salt intake or sleep disruption, with older individuals often showing more pronounced morning swelling. In clinical examples, individuals in their 40s or 50s may present with concerns about under-eye bags. Common contributing factors include alcohol consumption on weekends, high intake of processed food, limited sleep duration, and frequent use of over-the-counter pain medication. Physical examination often reveals mild eyelid swelling and nasal congestion, while heart and lung assessments and basic laboratory tests remain normal. In such cases, medical focus typically begins with correcting lifestyle factors such as alcohol use, dietary salt, sleep quality, and nasal health. These elements influence fluid regulation across the entire body. Only after stabilizing these areas does it become appropriate to refine posture, breathing, and lymph-related strategies. A structured medical approach often begins with evaluation of systemic conditions. This includes kidney function, liver function, thyroid status, heart health, autoimmune risk, and medication review for drugs that may contribute to fluid retention. The next step involves reviewing lifestyle patterns such as sleep duration, salt intake, alcohol use, smoking, hydration, and allergy or sinus symptoms. Patients are encouraged to identify realistic modifications based on their individual situation. If findings suggest mild fluid retention and muscle tension, referral to a physical therapist or a qualified specialist with experience in head and neck lymphatic care may be appropriate. When evaluation determines that under-eye changes are primarily due to fat pads and skin laxity rather than fluid, the focus shifts away from drainage techniques. In those cases, consultation with dermatology or oculoplastic specialists is more relevant for procedural or cosmetic options. Any sudden change in eyelid condition, especially if accompanied by pain, redness, one-sided swelling, fever, or vision changes, requires urgent medical evaluation. These symptoms are not suitable for self-care approaches. The overall perspective is clear. Under-eye bags are not random. They are not solely determined by age or kidney function. They can reflect a combination of fluid balance, lymphatic movement, posture, sleep patterns, and general health status. This understanding allows for more structured medical discussions, appropriate testing, and realistic lifestyle adjustments. It also helps distinguish when professional therapy may be useful and when cosmetic evaluation is more appropriate. These insights are intended to guide better questions and clearer communication with healthcare providers. They do not replace clinical examination or individualized treatment planning. Understanding your body's signals can help shape more informed decisions about health, habits, and long-term care. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.